Hi, it's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, and where we also provide tailor-made solutions for hospitals and intensive care units, whilst providing quality services for long-term ventilated patients and medically complex patients at home, including home TPN. In last week's blog, I talked about my dad is on a ventilator for 3 months and is suffering from major depression here in ICU. Can your service at Intensive Care at Home help us to bring him home? You can check out last week's blog by clicking on the link below this video. In today's blog post, I want to answer a question from one of our clients, and the question today is, can Intensive Care at Home be used for long-term ventilated adults and children with... Can Intensive Care at Home be used for long-term ventilated children with tracheostomy? I'm so used to reading out the intro where I talk about adults and children, but today's question is about, can intensive care at home be used to look after ventilated children at home? So this is a question we get quite frequently, and the short answer is absolutely yes. We have looked after many long-term ventilated children with tracheostomies at home. Sometimes the children that we're looking after are not having a tracheostomy and they're just on BiPAP or CPAP ventilation. Sometimes the children that we're looking after are not ventilated at all, but they still need an intensive care nurse 24 hours a day, because otherwise they would be at high risk of going back to ICU. They have high medical needs. And so examples for children that are not ventilated at all and don't have a tracheostomy would be for conditions like Rett syndrome, cerebral palsy, sometimes spinal muscular atrophy, but then those kids often have a cough assist device as well. They have secretions that need to be suctioned. They have seizures that need to be managed for kids with neurological conditions. Now, when it comes to long-term ventilated children with tracheostomy, we can shorten the ICU stay significantly by getting those kids home with 24-hour ICU nurses, pretty much continuing what happens in ICU at home and helping families and their children to go home much quicker. Nobody wants to be in ICU, keep in mind, especially with COVID still hanging around. You want to shorten your stay in ICU as much as possible. Other children we looked after at home are children that are not ventilated at all but are still having a tracheostomy, and we have successfully decannulated children at home. They just needed a little bit of extra time at home before they were able to be decannulated. That often happens with premature babies, and they have lung disease and they end up with a tracheostomy temporarily. And we have certainly helped those kids to maximize their quality of life at home rather than in ICU before they've been decannulated and having the tracheostomy removed. Other children that we looked after at home include children under palliative care. We helped facilitate palliative care at home for children with tracheostomies. We've even done a one-way extubation at home for a toddler. Again, much better place than doing a one-way extubation in intensive care. It's what families want, and we can certainly facilitate that with intensive care at home. Now, just finally honing in again on long-term ventilated children with tracheostomies. Again, we've taken kids home from ICU with C1 spinal injury, for example, but also after other respiratory or cardiac conditions where kids simply couldn't be weaned off the ventilator, and we have facilitated a much better quality of life at home with 24 hours intensive care, home nursing, instead of hospital intensive care. Now, if you look at our home mechanical ventilation guidelines that are evidence-based, it's crystal clear that under those guidelines that are evidence and research-based with ICU nurses 24 hours a day, it's possible to take kids home, and those nurses have a minimum of 2 years ICU nursing experience. You can actually continue intensive care in the home. It's safe, it's sustainable. It frees up an ICU bed. It cuts the cost of an ICU bed by around 50%. It creates an ICU bed for other admissions into ICU, and most importantly, it creates quality of life for children and their families at home that are no longer stuck in a depressing intensive care units. Kids can go back to school, which is what we've enabled many kids to do. They can go back to kindy. They can live their lives and have some sort of normality, and they're not confined by an intensive care unit any longer. There are other major advantages when we take long-term ventilated children with tracheostomies home. or when we take children home with medical complexities that still need an intensive care nurse 24 hours a day. The advantages are boundless. It's priceless going home instead of staying in ICU. I hope that helps, and I hope that answers your question. If you have a child in ICU and you need help, contact us at info@intensivecareathome.com or call us on one of the numbers on the top of our website at intensivecareathome.com. Thank you for watching. Now, if you have a loved one, adult or child in intensive care and you want to go home with our service Intensive Care at Home, and if you want to find out how to get funding for our service and how it all works, please contact us on one of the numbers on the top of our website or send us an email to info@intensivecareathome.com. Please also have a look at our case studies, because there we highlight more about what we can do for our clients, how clients can live at home with ventilation and tracheostomies, and you can look at our case studies as well at our service section. And if you are at home already and you need support for your loved one at home, and you have insufficient support or insufficient funding, please contact us as well. We can help you with all of the above. And if you are an intensive care nurse or a pediatric intensive care nurse with a minimum of 2 years ICU or pediatric ICU experience, and you ideally have a critical care certificate, please contact us as well. Check out our career section on our website. We are currently hiring ICU and pediatric ICU nurses for clients in the Melbourne metropolitan area, northern suburbs, Sunbury, on the Mornington Peninsula, Bittern, Frankston area, Patterson Lakes, South Gippsland, Warragul, Tridar, Druin, Moe, Trafalgar, also in Derrimut, Essendon, Thornbury, as well as in Wollongong and in Randwick in New South Wales. We are an NDIS, TAC and DVA approved community service provider in Australia. Have a look at our range of full service provisions. Thank you for watching this video, and thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I will talk to you in a few days.